Wallace, maybe you want to tell us more about what you do out there.
Yes, thank you for this interview. My name is Wallace. I am the Chief Operating Officer for Bali International Hospital.
Okay.
And my job involves making sure that the hospital runs smoothly, as well as making sure also that our strategic direction, we are moving along the direction accordingly.
Okay. Okay. Right. So, tell me your presentation today. Yeah, I heard you talking something about medical tourism. Yeah, maybe you want to focus that a little.
Sure. So what's interesting about Bali International Hospital is that it was created or set up by the with the mandate from the Indonesian government to create world standard medical institution and facility.
Wow.
And the first location, so they actually had to they have set aside 3 special economic zones within Indonesia that are catered specifically for medical tourism.
Okay.
And we happen to be the first one. So Bali International Hospital is in the Sanur special economic zone within Bali, and that is the first foremost the medical tourism hub that was created. This was in 2021, if I'm not wrong.
Okay.
By President Jokowi.
Okay. So, what kind of medical tourism do actually your patients come here for?
Right.
What specific area?
Correct. So for that, there's 2 parts. Maybe first I'll explain that the special economic zone is created for medical tourism. Is created uniquely to create an ecosystem for healthcare within and wellness within that area. And for that, the flagship is Bali International Hospital, where I'm in. But along that, you also have other services like aesthetic care, you have IVF, you have stem cell treatments, etc. So there's a whole mix.
So entire
holistic care within that ecosystem itself. And within the hospital itself, we are more focused on specialized care, multidisciplinary specialized care, ranging from 5 different centers of excellence. We have them in cardiology, focused in oncology, neurology, gastroenterology, and orthopedics. So these are some of the core expertise that we want to build within the hospital. So we are more catered for advanced specialized care, where if an Indonesian or even a foreign patient might need to seek healthcare, they don't have to travel outside of Indonesia to other countries to seek such expertise. They can actually come to Bali International Hospital and get the treatment they need for the wide spectrum of services and healthcare treatments that we provide.
Where do most of your patients come from across Asia?
Right. So today, the majority is actually Indonesian, but we also see a mix of patients from countries like Australia, Europe, US. We have Singaporeans within the region, Malaysians as well. The Chinese and Indians also do come in. So when you put together the whole foreign mix, they actually exceed the number of Indonesians that do come to the hospital today. And that's really exciting for us because I think the intention was, firstly to attract the Indonesian domestic audience, but
which we have achieved.
But yet at the same time, we've also managed to bring in the foreign traffic as well, which I think is really exciting for us.
Internationally?
We are, of course. We do have an expertise. We do have an expert marketing team that helps us to push the brand out, etc. And of course, we also have clinical partnerships, because when you want to build an international standard healthcare institution, it cannot be done just by bringing in the mishmash of Indonesian doctors alone. To be able to bring in new ideas, to have the knowledge exchange at our equal terms, or sometimes even expertise from outside of the country, that's important. And we do this primarily through clinical partnerships, of which today we have partnerships with 4 different institutions. First, for knowledge sharing, it is with the SingHealth group.
Okay.
Second, for operating partners, and the other three are all operating partners with Icon Cancer Center for Oncology,
Okay.
with the Sapporo Cardiovascular Clinic for Cardiology,
Alright.
and last but not least, our clinical laboratory is with Innoquest.
Wow.
So these are all regional players or even global players that have established renown across many countries, and because of that, I think that helps to really build the trust that allows the Indonesians to, and as well as the other patients, to actually make the decision to come and seek treatment with us.
Wow.
That's important to us.
Yeah. Fantastic. Thank you. Thank you so much for sharing this.
Yeah,
All right.
it's our pleasure.
Thank
It's
you.
my pleasure. Yeah,
Thank
thank
you.
you.